What I can tell you is that we have identified 162 new cases of COVID-19 in Alberta. This brings the total number of cases to 2,158. We have completed 2,779 tests over the last 24 hours. Sadly, I must report 2 additional deaths related to COVID-19. A male in his 70s in the Calgary zone and a female in her 80s in the North Zone. I want to express my sincere condolences to the families and friends of these individuals. The scale of this pandemic means we often talk in case numbers, but we must never forget that every case is a person. Every death is a tragedy for the people who love them. I want to talk about smoking, vaping, and drinking alcohol. As you know, COVID-19 is a respiratory virus. Many Albertans have asked me if smokers and vapers are more at risk, and if stopping smoking will protect you from COVID-19. Smoking and e-cigarettes can expose the lungs to toxic chemicals. It is not yet clear whether these exposures increase the risk of catching COVID-19. However, they do increase the risk of severe illness for those who get infected. There is growing evidence to suggest quitting smoking or vaping, even temporarily, can have positive outcomes in the prevention and treatment of COVID-19. Smoking increases the risk of poor outcomes from any lung infection, and this virus mainly affects the lungs. When you are smoking or vaping, you are also touching your mouth and lips. This can make it easier to catch the virus from your hands. Given all these factors, I strongly recommend that anyone who smokes or vapes take steps to quit or cut down during this pandemic. I know quitting is not easy. It takes incredible determination and support. This is a stressful time, and quitting can add to that stress that many already feel. Having said that, in a time when it feels like we have little control over many things, this may help to focus on one thing that you can control. Please check with your pharmacist or your doctor to see if phone support is available to answer questions about your options to help support quitting or cutting down. Alberta Health Services also has several programs that can help, including a free Alberta Quits hotline that can provide confidential support every day of the week. It's also important that we limit drinking alcohol during this time. Alcohol consumption can make many things worse, including health issues, risk-taking behaviors, mental health, and violence. All Albertans should be mindful of how much they are drinking. No more than about 2 drinks per day are recommended for women and 3 drinks per day for men. Canadians can also follow the National Low-Risk Alcohol Drinking Guidelines for details about when alcohol is considered to be a risk. It's more important now than ever to look after both your physical and mental health. These are challenging days, and I know this virus is taking a heavy toll on families and communities. I know many Albertans are wanting to see that light at the end of the tunnel. Rest assured, we are doing everything possible to limit the spread in Alberta and get our province through this incredibly difficult time. Remember, the best thing anyone can do to protect ourselves from COVID-19 is to practice physical distancing, wash our hands regularly, and follow all other public health measures that we've put in place. We will get through this together.